I wanted to also talk about specific supplies for a patient. So if you had some kind of a skill that you needed to do on a patient, so maybe NG tube insertion, trach care, that kind of thing, the supplies specific to that task will be in the room next to the patient, so you don't need to go off searching for them. Also wanted to discuss your resources. So in the hospital setting, you usually have people that you can talk to. There's the other nurses, and you will have your other classmates who are your nurses to talk to about what's going on. Someone probably has been chosen as the charge nurse, so she or he may be your resource if you need help with anything. You can call the nursing supervisor on the phone, and the nursing supervisor can give you some guidance as well. There also will be various books around, skills books, medication books, that kind of thing. So be sure that you are aware that you're not being left out in the cold, that you have many places to go if you don't know what to do next. I wanted to review the charts. We have made charts for all of your patients. So you'll notice in the front of the chart here, there are some extra papers. You can ignore these entirely because these are just extra sheets for us to use in the future. Every patient has a cover sheet which gives you the information regarding the patient's age, birth date, weight, height, religion, medications, allergies, physician, history, and a brief explanation as to why the patient is here. You will then find, let's see here, there will often be a code sheet or a condition of admission. So actually, here's your code sheet here. This patient is a do not resuscitate patient, so that'd be good information to know. Then we have the physician order sheet, so be sure to check that when you go to look at your medications or the tasks that you need to do. There are some extra ones behind that in case you take a telephone order or a physician has come in and written an order. You've got a medication administration sheet. These are the medications that have been scheduled for this patient or already ordered for this patient with the times that they should be given. Keep in mind that you're on day shift, which is this middle section here. You will also do your documentation in this chart, so if anything that you would have written ordinarily or put into an EMR, you put it here. Here's our Form 2. Everybody's familiar with Form 2. There may be one already filled out on your patient if they've been here for a while, which would give you some information. And there's also a place for progress notes. This must be a new patient because there aren't any yet. But that's a place that you can write what you need to do. Actually, there's some on this page from a previous shift. Some patients may have an EKG. They may have labs. They may have x-rays. There might be a post-op report. It depends on your patient's issue, what you'll find in this chart, but be sure to look in that section. And then there's also usually an I&O sheet in here, which again you can complete when you're going through your simulation.